Tayo Cruz and Pitbull with There She Goes. Okay, my guest of the day is on the phone.
94.3.
This is Good Morning Mumbai with Hrishikesh.
It's our work from home series, and we're trying to give you or equip you with the best information possible given the COVID-19 crisis. Pleased to welcome on the phone line Poonam Muttreja. She's Executive Director of the Population Foundation of India. Hi, good morning, Poonam. How are you doing?
I'm doing well, thank you.
Poonam, what's the existing healthcare infrastructure to battle COVID-19 in rural India? Since we're also obsessed about what's happening in the metros, let's focus now on the rural part of India.
I am so glad you're doing that because that's much needed. We have very little infrastructure. In fact, what we will not be able to treat COVID patients at the sub-center and district, we will have to bring them from villages to districts to treat them for, God forbid, when people get COVID. The people who are doing better with COVID can be treated at community centers, but the patients who are serious will have to be brought to district centers. The only good infrastructure, actually, fortunately, in the last 12 years that we have developed in our rural areas is the great ambulance network. We have very well equipped ambulances across the country. They're called 104, 102, 108. And if people travel across the country, you'll find them in small towns, villages, everywhere. So that is a service that has worked, and let's hope that will take people on in time to facilities like ICUs, because we can't create ICUs in the village with no question. So the village level, we will barely be able to do, only identify them.
Now, how can women in rural India play a big role in fighting the virus? Where do you see them coming in?
So women actually are the foundation for India's public health system. Do you know there are about more than 9 million Ashas? Ashas are the community health workers. They are the foundation of India's public health system, and they are not even on full-time salary. They get incentive-based salary, or for what if they do a particular task, like they take a woman to a family planning service, then they will get 100 rupees or 200 rupees depending on the service. Or if they take a pregnant woman for a facility, or they do antenatal, postnatal. Now they've been given 1,000 rupees extra as fixed income. Starting last week, a government order was passed on the 2nd, where they are the ones who are responsible at the village level for identifying, preventing, promotion, all aspects of COVID at the village level. Then there are the ANMs. Now, but going beyond them, how can women play? So women are playing a role. And let's salute the Ashas. Today is World Health Day. Let's not only salute the doctors and the nurses, which we must, but these Ashas are our foot soldiers. So I'd really like us all to salute them. Second, how can women play a role? First of all, women can do a lot in terms of making sure that within their limited resources, there is healthy food put out on the table. This is the time when we are all locked in. If we are going to have heavy fried, unhealthy food, we are going to have further health problems. So this is the time to remain healthy. The other thing women can do is support each other to make sure that violence does not increase. Violence has increased. Interpersonal violence, violence from partners and husbands towards women. We can support each other by ensuring that women experiencing violence is prevented, and we are there to support each other. Third role that women can do is to find every way to convince their partners and use protection so that they don't have unexpected pregnancies. Keeping the men away is the best thing they can do.
I'll take that with a pinch of salt, but I see where you're coming from, considering our population explosion currently. More with Poonam Muttreja, Executive Director of the Population Foundation of India, up ahead. It's Elvis Presley in the mix now, courtesy Paul Oakenfold. I'm Hrishikesh, and this is a little less conversation. Sting, going back to his police-like rock roots, I can't stop thinking about you. The Population Foundation of India is a national NGO which formulates and helps implement health and development strategies, and what they're doing assumes a very important role in this COVID crisis. Poonam Muttreja, PFI's Executive Director, is on the phone with me.
94.3.
This is Good Morning Mumbai with Hrishikesh.
Now, you did fleetingly mention the Asha and the Anganwadi workers. I want you to actually give us the intricate details of how the Asha and the Anganwadi workers actually are helping to fight this particular battle. If you could just describe their average day.
So an Asha has to go to X number of households. It could be 20, it could be 30. Under COVID, she has to do many more houses. So she goes to different houses. She takes the weight of the newborn. She does the to see if people who have ongoing sicknesses like blood pressure and so on. She not only takes that, but she also records the health situation in families. And right now, she's supposed to go and convey to every household what preventive measures they have to take in terms of what we call social distancing. What are the health precautions, how to protect the elders, the children, food. She gives information on food. Then she also has to tell them about the entitlement that the government, each state has announced entitlement. So it is Asha's responsibility to share with the family where they're going to get additional rations or additional PDS. Under PDS, they're going to get additional money and so on and so forth. Then her role is also at this point of time, it used to be to distribute condoms, but right now we still hope she's distributing condoms. So condoms and family planning is no more a priority. She has to make sure that women who are pregnant are looked after and then taken to health facilities for checkup. She has to make arrangements for pregnant women who are delivering to go to the hospital. She has to inform the local authorities if anybody has a cold, fever or cough and get direction on how to deal with them. She also is the person who is going to be responsible for ensuring that cleanliness and hygiene is maintained in the villages.
Poonam, a lot has been said about India's response to the pandemic. Let's delve into that. How has our response been to the pandemic in comparison to other countries?
Two things. Government did the right decision given the fact that we don't have a good public health infrastructure. I think government did the right thing in clamping down and doing a shutdown. From the health side, we've done very well in the sense the kind of preparations I am seeing in the health ministry, both at the state level and at the center level, have been phenomenal. They all recognize and know, nobody will criticize, but let me tell you, everybody in Nirman Bhavan knows and in the state level knows what a poor infrastructure, health infrastructure we have. We invest very little money in health. We only invest 1.3% of the GDP compared to the rest of the world. But now look at this disease. This disease is unknown to us and it's such a horrendous disease that countries like America and England and other European countries where they invest so much more in health. Unke ghutne tek gaye hain. They have had to bow in front of this damn virus. But so I would like to say that India's planning in ensuring, and especially where India is doing very well, is identifying the potential positive person and then segregating them, and those who are found positive, ensuring that contact establishment is done, and after contact establishment, people are put in the right place for seclusion or quarantine. So I think there I am very happy to see India do well. Thirdly, India very quickly, even though WHO said we don't need masks, I think India made the right decision 2-3 days ago, giving advisory to everyone wear a mask. Now, where we've done very badly is we do not have. We could have spent the last month or so getting better prepared to protect our health providers. Our health providers need PPE. We cannot afford to have our health providers falling sick, and it's very unfair. So there, I think we are only just about getting our act together. But, when I say getting our act together, there's a big seriousness where, the government is asking people who are producing garments, I know, to try and produce PPEs and masks and so on and so forth. So I would say the score is 50-50.
50-50 in all fairness is how Poonam Muttreja would describe the current situation. Fair enough. More with the Executive Director of Population Foundation of India up ahead. Don't go anywhere. This is Car Wash by Christina Aguilera and Missy Elliott. I'm Hrishikesh. Slow down is what Selena Gomez says, and that's exactly what we're doing in this lockdown phase, slowing down. In 1970, the Population Foundation of India was formed under the leadership of the late and great J.R.D. Tata and the inspirational Dr. Bharat Ram. Today, they work with the government at both the national and state level in the area of community action for health. guest, Poonam Muttreja, the Executive Director of PFI, is chatting with me on the phone on the current health crisis.
94.3
This is Good Morning Mumbai with Hrishikesh.
Radio 1.
How will India mitigate the risk from other services which will get neglected, especially for women and girls, given that the entire health apparatus in the public sector is focusing on COVID-19, Poonam?
So now first remember that India's poorest spend 70% of their expenditure on health is in the private sector, which is a reflection of how poor our public sector is. Now the problem is that right now the private sector does not have, I am not a champion of the private sector by any imagination, but the poor would rather not lose a day's wage than sit in a government hospital, and they have greater faith in the private sector. So they go to the private sector, which is right now closed. So one thing India has to see is we have to provide protection, provide passes and, infrastructure for the private sector to participate. Now, it is, the rural communities that you are very rightly and we should be concerned about today. They are going to have access neither to the private sector nor to the public sector very much other than COVID cases. The only people who are going to get attention going forward, and especially if there's a surge, is COVID cases. And I'm sure even maternal health services will get affected. So the future for the poor, they will die of malnutrition, they'll die of poor health services as well as corona. For them, it's a very bleak scenario. I think getting the private sector to share the burden with the government, we don't have a choice but to do that right now at the national level as well as at the village and district level. Now, if we are able to give nutrition, through Anganwadi workers and through Ashas and other feeding programs, at least people will have some nutrition. They won't die of starvation. So that's very important. The government to get its act together. NGOs are playing a huge role, and the government has finally recognized the role of NGOs. They've set up a committee chaired by Amitabh Kant, the CEO of Niti Aayog, to collaborate with the NGOs. I think there is huge opportunity there again. There is a lot of NGOs that are working both in the health sector and in providing food and essential service, but they're all having challenges because, it's not clear what this lockdown means. I think we need to give greater clarity to districts and the state machinery, telling them to cooperate and give permission. The police too needs to, use their sensibility, their intelligence and instincts to allow those who are helping, whether it's in the private sector, NGO sector, or government, to provide the services. We can't be bureaucratic and, allow dandas to help NGO people who are trying to, they're having huge challenges doing what they're doing. So this committee has been constituted, but it takes time to settle. So again, I'd like to say that rural areas, we all have to just pray that it doesn't spread to rural areas, honestly.
Up ahead, I do want to address the rise of domestic violence against women during the lockdown. The United Nations has also commented on it, so please stay on the line, Poonam. Poonam Muttreja, the Executive Director of the Population Foundation of India, is my guest of the day. You're a Chris Brown and Pitbull with some international love. The Kaiser Chiefs, gotta dig them if you're a rock lover. The Population Foundation of India addresses population and health issues within the larger discourse of empowering women and men. We are assessing some important issues concerning the COVID-19 crisis and lockdown with their Executive Director Poonam Muttreja. More conversation.
94.3
This is Good Morning Mumbai with Hrishikesh.
Radio 1.
There's been a considerable rise in domestic violence against women during the time of the lockdown. The United Nations themselves have said they're seeing a rapid increase in complaints. So your thoughts on that, Poonam Muttreja?
That is to me the most frustrating right now with this close down, that women cannot report, women can't step out, women can't take support. See, a lot of women have their strategies to escape the partners who beat them, whether it's their husbands or partners in other ways. And they have ways of, going to the fields or having their local support systems with friends. And of course, there are the NGOs and there are the helplines. Right now, they can't even make a call. So what I would like to say is we should make public appeal through the medium, using the media, and I think the Prime Minister and all the Minister, both Minister for Health, but the Minister for Women and Child Development and state level. I think we should recognize this as a crisis for women and do everything to give the right messages and partly threaten, but say we need more helplines. But it's easy to say we know. We've always said, we in the women's movement have always said we need more helplines for women and we need shelters for women. But right now, there's no point saying that because we don't have adequate helplines. So at this point of time, even the police should be instructed to help women who are, or families that are being, where there are reports of violence. Second, it is we as citizens, we should be watching. If my son is beating his wife, I should be intervening. Others should be supporting. ये कोरोना हमें खाने आया है, कोरोना का time है. We should be nice to each other at this point of time. We should be sharing happiness and joy and supporting each other. And I would ending violence should be top of our agenda because this is going to completely destroy the mental health of a lot of women. And you asked me the first question, role of women. What role will they be able to play as mothers and supporters of the household if they are being beaten and their mental, emotional state is fragile?
Yeah, violence of any form has got to be condemned and dealt with. A last leg of conversation with Poonam Muttreja of the Population Foundation of India. Slipping in some Eminem now, the real Slim Shady, only on 94.3 Radio 1. My name is Hrishikesh. Michael Bublé there, and I do hope it's a beautiful day for you and you're home and safe. And our hearts really reach out to our brothers and sisters who are homeless at this point of time. But we have to overcome. An eventful conversation on the phone about the current state of lockdown and its impact on rural as well as urban India with Poonam Muttreja, the Executive Director of the Population Foundation of India. A last leg still to go.
94.3
This is Good Morning Mumbai with Hrishikesh.
Radio 1.
How are you and your colleagues managing working from home, and what is your personal timetable of actually an average working day?
So we all are supposed to work from 8 hours, so 9:15 to 5:15, and we all send messages to each other. I'm on my desk. Hi, this is what I need from you. And then every staff member sends, as soon as they get into their computers, they send, and this is not our cleaners. Our cleaners are restfully sitting at home. I mean, people who clean our office or people who do office maintenance, they can't. But the program staff and some of the executive staff, they're all working. And what we do is we say in the morning what is our plan for the day and what we need from different colleagues. And at the end of the day, each of us send a report. So the report goes to their line managers and it also goes to HR, the head of our HR and me as the executive director, so that we all know what we are doing. And when people need to take time off, I have said to our staff, you have family responsibilities, children are at home. So if you need to, and I'm encouraging my male colleagues to help in the house, whether it's washing dishes or cooking. So everyone's been told to send a message that I will not be available for an hour and a half. And most people are showing off, I'm helping my wife, I'm helping my son or whatever with school. So everybody says what they're doing. So, and at the end of the week, we all do a weekly report and then we analyze what we need to plan for the next week. So we are doing it very systematically, but we did this a week before the shutdown. We knew we would have to shut down. So we had done all the planning. Second, we are doing a lot of firefighting. Some of us are working morning to late night because we are managing COVID-19 page of the government to share information on COVID prevention, promotion. We have a section called Khushiyan Bantiye. So we have a lot of information we are giving. We are making little films online. So we're providing all the information on COVID called MyGov, the page. So some of us are working day and night to see what messaging every day we need. For instance, when the attacks on nurses or people didn't want doctors to stay in their houses, we started saying, to salute the doctors and out of respect, we started sharing messaging on that. Then, on all the health prevention related, what do you do, what do you not do. So some of us are working day and night, but feeling very good that we can do something even within the four walls of our house.
My last question to you, Poonam, is how is the Population Foundation of India working to help the COVID-19 situation in terms of the groundwork done by the team during the pandemic? I understand that you're home and you've been doing all this wonderful advocacy and messaging online, handling the government page, but on the ground, the contribution that the PFI has made.
tell you how. So we are developing WhatsApp messages on family. We have developed. They're going to roll out. We've spoken to various state governments. State governments have ASHAs, ANM, and general population phone numbers. They have SMS. So the general population, we are making materials which will go in the form of SMS, and ASHAs will get WhatsApp messages on what to do, what not to do, and on their entitlements. All these entitlements that the government is announcing, people don't even know about their entitlements. So we want, whether it's pension for old age. So we're going to send out messaging how you can get the pension. Then the second thing we're doing is a lot of NGOs that are distributing food and are doing various services. We are raising money for them from our donors and other donors. There are a lot of coalitions being formed. So in those coalitions, those who know how to do food distribution or jobs, who were working with immigrants, we give the health information to them, what to share with the community. So we've done little, not just videos, but little messaging on various aspects that people need. The final thing that we are doing is we are trying to see if condoms can be distributed through various systems, which we are trying to roll out.
Poonam Muttreja, Executive Director of Population Foundation of India, thank you very much for talking to 94.3 Radio 1, and have a great day ahead. Bye-bye.
Thank you. You too. Bye-bye.
It's a fab duet by Charlie Puth and Kehlani, done for me. I'm Hrishi K, and it's 94.3 Radio 1, One World, your station.